Overtraining syndrome. How much training is too much training? Injuries and fatigue are two things that are often associated with the job description of an athlete. With the right care and maintenance, these are factors that can be kept to a healthy degree. But when an athlete is pushed past their limits to a point where the severity and/or occurrence of these things increase, this is when training becomes detrimental to the health of an athlete. This is known as a condition called overtraining syndrome, also referred to as OTS. OTS is defined as a set of persistent physical and psychological symptoms that occur after an athlete endures excessive training loads. OTS is a very common pitfall for athletes, affecting more than 60% of distance runners during their athletic careers, more than half of professional soccer players during a 5-month competitive season, and 33% of basketball players participating in a 6-week training camp, according to published research. And OTS doesn't just stop there, it spans the entire athletic community. There is no objective biomarker for OTS, and the underlying biological mechanism is unknown. But failure to integrate appropriate recovery time into a periodized training program is the most common cause of overtraining syndrome. Normally, as a training load increases, there is an initial rapid improvement in fitness. Further increases produce diminishing returns until optimum training is reached. However, OTS is rather different. OTS occurs when inappropriate recovery time is allowed between intensive bouts of exercise. Failure to allow the body to recover substantially from the last bout of exercise means the recovery from the subsequent session becomes even harder. This gradually leads to a decline in preparedness to perform. There are symptoms and signs for detecting OTS in an athlete. This includes long-term fatigue, lack of motivation and energy, being irritable and discouraged, trouble sleeping, mild headaches, and back pain. But the problem lies in the fact that these symptoms are diagnosed differently in normal people compared to athletes. In a normal patient, it would be suspected that this person has major depressive disorder, also referred to as MDD, and a doctor would recommend a combination of counseling and/or medication. But in an athlete, these symptoms would be overlooked, saying that the athlete is just burnt out or overtrained, and a doctor would suggest that they consider a trial of rest. MDD, as a neuropsychiatric disorder, causes profound chemical and role dysfunction that is remarkably similar to the effects of OTS in athletes. The major difference being that the role dysfunction in athletes relates to the major role in their life, athletic training and performance. But this difference is what creates the problem, as a lack of detection and proper recovery causes OTS to lead to a great number of health problems, both physically and mentally. Identifying youth at risk of overuse injuries is the first step to prevention. Educating parents and athletes and coaches on the topic of OTS must be part of the plan to promote fun, skill development, and success for each individual athlete. Skilled young athletes must be mentored carefully to prevent excess participation, which may affect them physically as well as psychologically. Part of this education should include setting guidelines for parents, coaches, and athletes to provide opportunities for education, injury reduction, and early recognition of overuse injuries. Many methods have been used in an attempt to reduce the occurrence of OTS among athletes. One method is to incorporate sport-specific drills that use a variety of modalities into training regimens, such as water running for the track athlete on alternate days, which may provide similar fitness benefits with less stress to the body. A method of prevention for athletes participating in 2 or more sports is to ensure that they get sufficient rest between activities and/or a break between seasons. In addition, athletes should have at least 2 to 3 months off per year from their particular sport, during which they can let injuries heal, refresh the mind, and work on strength, conditioning, and proprioception in hopes of reducing injury risk. Length of time off and frequency may differ from sport to sport. Areas of OTS that still need to be explored are the biological causes, developing a universal protocol for diagnosis, and development of prevention tactics. While we know what external factors cause the emergence of OTS in an athlete, we are still unsure of the biological factors that cause symptoms of OTS to occur. If we are to discover this, it may lead to the development of specific tactics that can be used to prevent the occurrence of OTS. There are currently minor ways to try and avoid OTS, but there is nothing concrete with a high success rate of prevention. By determining the exact cause of OTS, we will also be able to develop a universal protocol for the diagnosis of OTS. This will ensure that athletes who develop this condition receive the treatment they need and hopefully prevent athletes from developing it in the future. Thank you for taking the time to view this presentation. I hope that you now know more about overtraining syndrome and the effects it can have on an athlete.